adults. This is a partnership between the Mental Health and Addiction Advocacy Coalition, otherwise known as the MAC, the Benjamin Rose Institute on Aging, and Cuyahoga Community College, otherwise known as Tri-C. I'm Burt Rawl. I'm Director of Mental Health at the Benjamin Rose Institute on Aging. We've partnered with the MAC. The MAC is a membership-driven advocacy organization operating throughout the state of Ohio with a mission to foster education and awareness of mental health and addiction issues while advocating for public policies and strategies that support effective, well-funded services, systems, and supports for those in need, resulting in stronger Ohio communities. The MAC membership represents over 100 diverse stakeholders in the field of behavioral health, including provider agencies, the Adams boards, government entities, court systems, the faith-based community, and more. These members help guide the MAC's work by identifying important behavioral health issues for advocacy throughout the state of Ohio. So Benjamin Rose was founded in 1908 when Mr. Rose died and left his estate and said, please take care of older people, which is one of the things that the Institute does. In 1989, we applied for and got a grant from the Cuyahoga County Mental Health Board, and we've been providing mental health services since then. So the question is, why now? What's the big deal? Why should we be concerned about this? The reason we should be concerned about it, of course, is because of the numbers. If you look at the population of Ohio, this line here, the dark blue one, represents the population of people 65 and older. And if you look from 2000, it's been steadily increasing. In the year 2030, it will reach a point where 1 in 4 people in the state of Ohio will be over 65. When we look at incidence of mental health in the general population, this slide shows males in blue, females in red, and you can see that they're almost equally divided in younger years. As they get older, the numbers decrease, but in part the change is due to the fact that males die at a faster rate than females. But we're still looking at a significant number of people, and of concern, of course, is the people not only in the aged group, but in the 70-plus range. If we look at the incidence of mental health overall in the United States, we look at almost 18% of the population suffers from a severe mental illness. That's 1 in 5 people, broken down by male and female, then by age range, and then, of course, by race. If we compare Ohio to the United States in general, Ohio's in the light blue, the United States is in the purple, and you can see that people 50 to 64 years of age represent a significant number of individuals already. And this group, the 50 to 64, will be continuously aging through time, and by 2030, this will be a substantial number of people in the Ohio system that we have to provide for. The mental health system is in dire need of geriatric specialists, and we need many people on the front lines who are educated and know how to help the growing population that's going to become old, have medical problems, as well as mental health problems. We hope you find this series educating and will be helpful to you in the services that you provide to our Ohio consumers. Thank you.